The family of the former Chief Executive Officer of the Jaramogi Oginga Odinga Teaching and Referral Hospital, Dr. George Rai, is appealing for help to raise 20 million shillings to clear a medical bill accrued while he was receiving treatment in South Korea. Dr. Rai, who was currently serving as a health advisor for the Kisumu County Department of Medical Services, is reported to have fallen ill while on a work-related tour in the East Asian country and died while receiving treatment. His body cannot be repatriated back home until the bill is paid in full. Safina Chengoma reports on the agony of a family that is stuck while in mourning.
Until his death, Dr. George Rai served as the head of partnerships and resource mobilization for the Kisumu County Department of Medical Services. According to the family, Dr. Rai left for a work-related tour to South Korea on 30th of November 2025.
George Rai was not sick. George Rai was well, and that is why he was part of a county delegation to Korea.
The family says that this picture was taken on 4th December 2025, a few minutes before Dr. Rai suddenly fell ill.
They were on a tour, I'm told, of the Parliament building, and when they were coming out, as he was getting into the bus, he fell suddenly, was breathless. Emergency services were called, and he was taken to a nearby hospital.
Dr. Rai was admitted in the intensive care unit at two main hospitals in South Korea before he succumbed on 26th of December 2025 at around 7 p.m. Kenyan time. His family is now facing the nightmare of raising about 20 million shillings to offset the medical bill and the daily mortuary charges before they can bring his body back home.
The costs kept accumulating. The county wasn't clear on what the extent of responsibility they will take. The bill was amounting to over 17 million Kenya shillings, out of which some money had been paid, about 3 million, out of the money that KMA had sent and the family had sent to Korea.
Before joining the county's Department for Medical Services, Dr. Rai served as the Chief Executive Officer of the Jaramogi Oginga Odinga Teaching and Referral Hospital in Kisumu. According to a tribute shared by the hospital, Papa, as he was fondly known, pioneered the sickle cell zero movement and the establishment of a warrior support group. He is celebrated for facilitating the availability of bone marrow transplant services at the facility and other transformative infrastructure, including an oxygen plant that provided life-saving piping to wards during the COVID-19 pandemic. The president of the Kenya Medical Association, Dr. Simon Kigondu, also hailed Dr. Rai's contribution during his tenure as the chair of KMA Managed Healthcare Committee, where he steered a health reforms engagement which resulted in a landmark document that informed improvements in the services provided under the defunct NHIF, now known as the Social Health Authority, a legacy that is a sharp contrast to the unfortunate fate that has now befallen the late senior doctor and county advisor, who dedicated his career in making health accessible and affordable to all.
The health system and the government has led our colleague down. That it is happening to a high-level professional is an even bigger indictment on our system. It doesn't work. We have been to SHA, and SHA told us clearly that their policy does not allow them to take care of somebody who falls sick when outside of the country.
The county government of Kisumu has committed to support the family to meet the expenses of repatriating Dr. Rai's body back to Kenya. This, however, is subject to the settlement of the outstanding bill of about 17 million shillings, which the family says remains their biggest nightmare.
This person was on official duty for county and for government. What is the responsibility that is taken here? Is this money too big for us as Kenya government, as county government, to clear and sort everything out.
Their hope is pegged on well-wishers to support them bring Dr. Rai home and accord him a decent burial.
The family can't understand how you can work so hard. No, it's bad.
Safina Chengoma, Citizen TV.